Well, good morning, good afternoon, or good evening. This is Alice Bonner from the Institute for Healthcare Improvement, and I'm going to present just a very brief, maybe about 5-minute overview of Quality Assurance Performance Improvement, or QAPI, for nursing homes. You're going to hear a lot more about this topic in later sessions, but today we're just doing a very brief overview to get you thinking about QAPI. Now, the regulatory development really started back with the Affordable Care Act, and there's been some subsequent survey and certification letters after that. And it requires CMS to establish standards and provide technical assistance to nursing homes on the development of best practices related to QAPI. And surveyors may ask for QAPI plans at any point during a survey or upon request. Some of you may use this guide. It's called QAPI at a Glance. It's a short guide, maybe about 20 pages, and it was developed at the same time as the regulations were being written. It's still up to date, and it is a useful tool to help any nursing home as they're developing and putting together their QAPI plan. So it's just a good guide, a good framework, and it may be useful to you. Now, there are a number of basic features to QAPI that are outlined in this slide. This really sums it up in a nutshell. QAPI uses a systems approach. It works to improve quality of healthcare and the residents' environment, as well as the environment for workers and care partners. QAPI is really data-driven. That's one of the key elements, and it doesn't wait until an adverse event happens. It's proactive. It involves staff at all levels, and it identifies gaps in the center systems or processes and continuously monitors the effectiveness of any interventions. These are the 5 elements of QAPI just listed on this slide. And so as you're going through the development of your QAPI plan, or if you're revising your QAPI plan, you want to make sure all 5 of these elements are in the plan somewhere and are addressed. So we're not going to go into great detail today, but just very briefly, each of the elements. So element number 1, design and scope. It's got to demonstrate that the QAPI plan is ongoing, it's comprehensive, involves all departments, and that it really focuses on person-centeredness and autonomy and choice. The second element, leadership and governance. This is really critical. The leaders of the organization, whether it's the board or people in leadership positions in administration and clinical roles in leadership, must all be involved in QAPI. As we said, this is a data-driven process, so getting feedback and having data systems that allow you to collect the data and to be able to analyze it, this is really critical, and to be able to look at adverse events in order to develop action plans and to do a root cause analysis for each of those adverse events. Element 4, which is about performance improvement projects, sometimes called PIPs. This is a way to identify where there are gaps and opportunities, how to design and prioritize PIPs, and how to look at the data as a result. And then finally, systematic analysis and systemic action just gets back to the notion that this is a systems approach, and after doing initial PIPs, go back and look at where you can integrate all of these approaches together and align all of them in a systems approach. And this slide just sums up, these 12 action steps for how to develop a QAPI plan. Very, very high level, but again, you'll see this in QAPI at a glance. It's just a way to frame the work to get started. And in addition to QAPI at a glance, we provided these other references and resources which are on the CMS website. They're very helpful and gives a lot of examples of how to go forward. So that's all we have for today, less than 5 minutes, but if you have questions, this is my email. Please feel free to contact me. I'd be grateful to hear your thoughts, your ideas, and suggestions, and answer any questions that you might have. So thanks for tuning in. Take care.